student nurse NP from the US University. So today we're gonna be do the examination for the neural system for the patient. My name is Tony. I consent for video for education purposes also.
Hi, I am Teresa. I consent for filming education purposes.
And then we're gonna be upload the video on the YouTube. Are you allow me to do it?
Yes,
And then we just do for the education only.
yes,
Okay, so from now we're gonna be go ahead and do the examination for the patient. So for the neuro, first we have to check for the patient for orientation. So she come to the um, so before that, before access the patient, we check for the identification for the patient through identification, the name and then the day of birth, provide the privacy. I washing my hand and I explain the. So today we're gonna do the assessment for neural system, for your brain, for your any muscle chain, everything for you right now. Okay,
yes,
and then I will instruction you step by step for today.
yes,
Thank you for joining me today.
yes,
All right. So okay. So the patient come to the office. She were appropriate for her um, her meeting today, and then she answered the appropriate. So we check for orientation. No, so the patient alert, awake, and then we can check for the she follow command. She answer the appropriate. Do you know? Do you, can you tell me your name?
My name is Teresa Nguyen.
What do you here for?
I here to check my health.
Okay, and then and then you know where you are right now? You're in the office, right?
Yes,
Okay. Um, so she know what she here for and she oriented. We can do the Glasgow coma scale to check for the patient. The patient alert, like the eye movement, follow command, and the motor every functioning. So she good. Um, so the patient alert awake every time for to name, place, and then you know where the day today is.
yeah, today is December 3rd,
Mhm.
um, 2022.
Name, place, time, and the situation. Also, we can check for the patient for the memory. So right now, I will give you the words, and then you try to memorize, and then later on, I can ask you again. Okay?
Yes,
Okay. So red car, white lily, orange juice. Can you repeat again?
gas car, white lily, orange juice.
Okay, I will ask you one more time later. Okay, and
Yes,
then we can check for the long-term memory. So can you tell me like the last five resident in the U.S. right now?
yes,
The recently right now.
the Joe Biden,
Okay,
Donald Trump,
okay,
um, Barack Obama,
okay,
George W. Bush,
okay,
and Bill Clinton.
okay. So that's on correct. So she memorized. Do you remember what you eat?
Yes,
What did you eat?
I eat rice.
Okay, just rice.
Rice with the fish,
Oh,
catfish.
okay, so that's good. So she remember what she eat before, so the memory is intact. And then we can test for the reasoning for the patient. Um, so, for example, like, can you tell me what happened uh, when you see the fire?
When I see the fire, I will take the fire
Fire
assist
extinguished.
extinguish,
Uh-huh.
and then
Use
I push on the fire to
uh,
cover the fire.
to cover. Okay.
Yes.
And then did you do anything? Call somebody or something?
Yeah, I will call the 911
All
to ask
right.
somebody can help me.
Okay. So she reasoning appropriately to the situation also. Um, so that's the condition is intact for the patient. So next we're gonna go to the check for the cranial nerve. So we start with the cranial nerve. Number one is olfactory. So right now, can you close your eye and then I will let you smell something and then you tell me what it does. Okay?
Yes.
So now you close your eyes. So I'm gonna you tea bag. Can you smell? What's that?
Yeah, the teeth.
Oh, okay, the green tea, yeah. And then it's gonna be one more, okay?
Yeah. Coffee.
Okay, so I give her the coffee round and then the tea bath. So she correctly for the olfactory. So can you open your eye again? So cranial nerve number one olfactory is intact, and then we go to number two is optic nerve. Uh, So see everything clearly as she come to the office by herself. So we know that she intact for the optic nerve. But today we're gonna check for the optic nerve, cranial nerve number two. So we do with the slide Snellen test first. Can you cover your right eye and then you can do this up to here.
LTFFH.
Okay, and then can you cover other eye and then you can do it here.
LTFPH.
Okay, and then you open both eye and you do it again.
LTFPH.
Okay, so her left eye and right eye is 20/20 with the correction up with the glasses. So we also check uh, for the eyes. So we're gonna check for the eye for her um, with the scope. You can see. Okay, can you remove your eyes? Mm-hmm. Very classy, yeah. And then I will check your left eye. Okay, so for your left eye, left hand. Okay. Okay, and do the same on this. Okay, okay, back. So I check for the retinal is normal. There are no hemorrhages for both eye, and then the vascular is no hemorrhages, no bugging, and the cup to this is 1 to 2 or 0.5. That's a normal finding. There are no bleeding. There are no any like infection on the eyes. Okay, and then now we go to the to check for the cranial nerve number 2, 4, and 6. Number I'm sorry, 3, 4, and 6. So number 3 is oculomotor, number 4 is cochlear, and number 6 abducens. So that's eye movements of the eye. So Teresa, right now, can you? We're gonna do cranial nerve number 4 first. Is the eye move laterally? This side. So that is number 4, and then we go number 6. We go oblique toward to the north, but inferior. Okay, and then on this side. Okay, so that is number 4, and number 6 is oblique, and then we go number 3. Right now is up. Go this side, go this side, go down, then go this side, go this side, go this side. Okay, that's good. So the cranial nerve number 3, number 4, and number 6 is intact. And I forgot to do the cranial nerve number 2. We also check for the visual field. For the visual field, like can you cover one eye, by the left eye? Okay, and then I gonna go here, and then tell me when you see the finger, you say now. Okay.
Now.
Okay. Can you see finger? No.
No.
Okay. See finger?
Yes.
Okay. Tell me.
Now.
Can you tell me when you don't see the finger and you say now?
Now.
Okay. And then we do the same on other eye. You see the finger, right?
Yes.
And then tell me when.
Now.
Okay. We check the visual field is normal. There are no any deficit for that. And then we back again for the cranial nerve. Uh, so we check for cranial nerve number 3, 4, and 6 for the eye movement already. But for cranial nerve number 3, um, ocular motor, we also check for the reflection of the pupil. So for the reflection of the pupil, I'm gonna be side the line to check for one side. Okay, and go other side. Okay, so the eye will be constriction react to the direct line. And then we check for the consensus. Okay, okay. So the people equal round react to the direct line and consensus. That's the normal finding for the patient. And then we go to the cranial nerve. Number 5 is trigeminal. The trigeminal is they have the 3 terminal. So that's the motor and then the sensation for the trigeminal. So we're gonna check first for the sensation. I'm gonna use the cotton ball and I'm gonna use uh, the Q-tube, the applicator. They have the downside here. And then ask the patient to close eye and then we check for the sensation for the top, the forehead, the cheek bone on the cheek side, and then on the chin. Okay, can you close your eye right now? So tell me door or sap when I'm touching your face, okay?
Mhm. Door. Door. Sap.
Okay,
Door. Door.
okay,
Sap.
okay,
Sap.
okay. So the sensation intact on the face. So now we check for the motor for the trigeminal. So for the motor, I have to put on um, her chin and then ask her to open the jaw. Open the jaw.
Ah.
And then close the jaw.
Mm.
So this jaw, there are no deficit for the jaw. Her jaw region. And then I go to, so we check number 6, abduction, do the when we check for the eye movement already. So we go number 7 is facial nerve. For the facial nerve, we check, that's a motor. We check for the upper and lower for facial nerve, cranial nerve number 7. So can you lift up your eyebrow like that? And then make smile. So the patient symmetrical for bilateral for the face. There are no sign of the stroke or the facial drooping. So the cranial nerve numbers 7 is intact. And then we go to number cranial nerve uh, number 8 is acoustic. That's for the hearing and the balance for the patient. The balance we can check later on with the cerebellum also. But for the hearing, we are gonna tell her whisper on one hand. But when the patient come here, she respond to the voice, everything correctly. That's intact. And then she doesn't wear any hearing aid or something. That's normal. But we're gonna do the whisper test for the patient. So I will whisper to your ear, and then tell me what you hear and repeat again. Okay? Apple.
Apple.
Okay, cover one. Oh, sorry, cover on left side. Apple.
Apple.
Car.
Car.
Fish.
Fish.
Okay, cover one eye. One your right ear, and then I can do a one. Um, light.
Light.
Okay, and then pork.
Pork.
Okay, and then meat.
Meat.
Okay, good. So see, the whisper space is normal, and then I gotta do the Weber test and then Rene test. For the Western test, we check for the conduction of the ear for both by for both sides. So we tap in the ear and then we put on the hand. Do you feel both ear same?
Yes.
All right. Okay. And then for the Renee test, I just demonstrate one on the right ear. I gotta demonstrate one, and then okay. So tell me you don't hear anymore. Okay. So I'm gonna be put the tuning fork to your ear, and then tell me when you don't hear anymore. Okay.
I don't hear anymore.
Okay. Okay.
I don't hear anymore.
All right. So the conduction for the Weber test is the conduction for the bone bilateral of the ear is equal for both ear, and then for the Rene test, AC air conduction is greater than BC bone conduction is a normal finding for the patient. So the patient had no problem for the deafness, for the deaf. She hear voice clearly, respond, and then the language is really good. And the speed, her language in I forgot to mention in the beginning is the speak. Her voice is normal, and then her speak condition is her speak is fluent, and then understand the language. Um, there are no sign of the speech deficits or the trouble for the speech in the cognition area also. Okay, so after number 8, we go to number 9 is losopharyngeal nerve, and then number 10 is the vagus nerve. That some kind is swallow on the back of the throat of the patient. So we're gonna be at the patient open the mouth. Can you open the mouth? Can you show here? And then we're gonna be side here. Okay, say ah.
Ah.
Okay, I see that you are going up, and then we can touching the back of the throat to see the gas reflex. I just explained, but we're not gonna do on the video today. But we can add a patient to drink the water to see any difficult to swallow. Can you drink some water when I hold you swallow? Okay, so that's a good. There are no sign of the aspiration pneumonia, the vagus nerve, and then radial nerve. Number 9 is lossopharyngeal nerve is intact. The patient can swallow. There are no. Usually, the patient have a stroke. They have a difficult swallow. Okay, and then we go to the radial nerve. Number 11 is spinal accessory. We check for the movement of the neck and the shoulder. So I gonna put Teresa. I gonna put my hand on your face. Can you move on your right? Okay, and then can you move on the left? Okay, again move right. Can you move left? Okay, and then I gonna put my. Can you lift up your shoulder and then put it down? Okay, so for the accessory, cranial nerve accessory number 11 is intact. The each joint once you moving uh, for the neck and the shoulder, the muscle is 5/5. There are no deficits. And then we go on cranial nerve number 12 is hypoglossal nerve. So that is the movement of the tongue. Can you put your tongue out and put your tongue in the middle? And then yes, and then the midline. Okay, put your tongue up. Put up your tongue. Yes. Okay. So now closing your mouth, and then I put my finger here. Can you put your tongue on your right and put your tongue on your left? So I see the tongue is strong. There are no problem for the tongues for the patient. So that's is cranial nerve number 12 is intact. So after we check for the cranial nerve, we're gonna be moving to um, the sensory for the patient. So uh, we can do for sensory for the patient. We sensory, yeah. So we can uh, check the sensory for the when so we can check the sensory when the patient closing and then the moving up the jaw for the patient. So Teresa, can you put your hand like that? Yeah, I put your glasses here. Okay, put your hand like that, and then you close your eye. And then I gonna move the jaw up and down and tell me it go up or go down. Okay.
Up, down,
Okay, and I do again.
up, and down.
And then we do the same for the toe. We up and down. Okay. Okay. So I can demonstrate here. Go up or go down. Look your eye
Up,
and down.
down,
Okay.
up, down.
So when the patient closing, we can move the toe and the hand up and down to see like the patient different between the sensation for the patient. And then after that, we can do the to check for two different point for the patient. I can use some kind like this one. So tell me that's a 2 point or 1 point, okay? Okay, for example, this one is 1 point, this one is 2 point. All right.
Yes.
So close your eye right now.
1 point, 2 point,
Okay, can do your hand.
1 point, 2 point, 1 point, 2 point,
Mhm.
2 point.
Okay. So see the like see difference between the sensation between 1 or 2 point sensation. You can take other side for the patient also. If we feel like any rough arm or complaint from the patient too. And then next we're gonna do for the here, some kind like we draw the letter or draw the sign on the patient, so she can tell what we draw. So can you do the hand like that? And close your eyes. So I will draw in your eye. Okay, your hand. Okay.
A,
Okay. Letter A, right?
yeah, letter A. B,
Letter B.
B,
Okay. And then
B, B.
okay. And then we go here.
C,
Okay, let us see. So she can feeling. We can take other side of the hand or the skin. We can check for the rhaphitia also, and then we can check for the sensation on the upper part and lower part for the patient. So can you close your eyes? So I when touching door and strap again. Okay.
doll,
Mhm.
sap, doll, sap,
And I can do for the foot, for the hand. So upper extremity is sensation is intact. Um, the patient can different between dull and sharp on the upper extremity, and then I can do a same on the lower extremity. So I can move uh, the camera low down.
doll, sap, doll, sap,
Okay, so the lower extremity is the sensation is intact. Also, can you close your eyes and then can you tell me up or down? Okay.
up, down, up, down, down.
Okay. So the patient also. All right. So the last thing we can check for the vibration for the patient, I can use a tuning fork, and then I can put on the body luminance, and then ask the patient, do you feel the vibration or not? So I can try anything like that. For the hand, we can do here. Do you see the vibration
Yes,
right here?
yes,
Okay.
yes.
Okay. The patient feel the vibration for the hand. So after the sensation, uh, we can check Oh, I forgot we have to before we do the sensation. We check for the cerebellum first. Um, for the cerebellum is some kind like the balance for the patient. So we can see the patient walk to the office. Um, so we can tell the patient. But I can put the cerebellum test later. Uh, but right now we can test for cerebellum because I forgot to do it. So can you go over there and walk for me? Just normal walk. So just walk normally. Okay. So I can do here. Okay. Can you walk? Walk normally. Okay. And then walk back. Go back. Okay. Do you feel any dizzy or something? No.
No.
Okay. So you can walk uh, tandem walk like this. So toe with your hand like that. So the toe with your heel, another toe with your heel. Now you can walk now. No, no, your toe has to step on the heel like that.
Okay.
Okay,
Like this.
okay, like this on the straight line.
Very nice.
Okay, and now you turn around and do one more time. Go back, go back.
Okay.
Okay, so she can no sensei no balance problem. Okay, now you go back again. So you walk okay, and now you walk to the walk like that with the heel. Walk with the heel. Go up, go up, and go back again. Turn around. Walk with the heel. Okay, no lumpy, nothing. Good.
No.
Okay, and then walk with the toe. Go up like that. Yeah, like go to the high heel. All right. Okay, and then go walk back. Okay, that's good. All right, that's good. And now you just now we test for the now we test for the rumbus test. Like ask the patient to closing the eye with the hand on the side. So close. So for the rumbus, so close your eyes. And then we count for 20 to see any balance problem. And then we also assist the patient on side to side. And now I have to count 20, okay? One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So the patient is negative with bumper test. Usually for the rumble test, for the rumble test, the patient who got the alcohol problem, they're gonna be losing the balance. They're gonna fell down. So for her, the movement, the cerebellum is intact. Okay, I forgot to test before that, before the sensation. And then we go to uh, the motor test, the muscle strength for the upper and lower extremity. We're gonna do more in the muscular, but we can test for the uh, muscular strength. Can you sit down again? So, so for the muscle strength, we check for the upper extremity first, and then we go down to the lower extremity. So can you do the fainting your hand like that? Okay, I will hold your hand. Do fainting again my hand. Put again my hand. Okay, it's strong. The finger is strong. And then can you closing? Close your hand. Okay, close it. Okay, it's strong. So the finger is strong bilaterally 5/5. There are no deficit for the strong. Um, and then can you do the motorcycle? And then put it put up, and then put down. So the breathe strong 5/5 bilaterally, and do like that. And then put again my hand. Put again my hand. Okay, and put again my hand. The bicep is strong, and the tricep is strong bilaterally. Uh, so her muscle is strong upper extremity 5/5. There are no deficits. And then I go down for the foot. Let's go down to the foot. Okay, can I please put your foot up? Okay, it's strong, and then put 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 in the middle. Okay, okay, put out. It's strong, and put up. Okay, put down. Again, my hand. Okay, put this one up and put down. Okay, the foot is strong over 5 over 5. There are no deficits. She can walk with a normal gait. So the motor we check is intact. We also check for the um, we also check for the uh, coordination for the patient, like moving hand to hand and slap on the thigh. You can do like that. Okay, and then move back, tap on the thigh, and move again. So the coordination between the brain is functioning normal when the patient do that. And then lastly, we can do for the reflection, relax for the tendon reflex for the patient. So for the tendon relax for the patient, we can use um, the hammer. So I demonstrate one side first. So on the right hand, I support with the left hand, and then we find the tendon. We find the bicep reflex first, the bicep tendon. So locate the bicep and go here to say relax, just relax your hand, and then I tap. Okay, so see flex. Okay, see flexing the arm, and then for the tricep, I have to locate the tricep on the right hand, the tendon here. Just relax, okay? Okay, that's good. Okay, so we do the same on that arm, on the left arm. Okay, so it's flex, and then relax your arm. I will support you. Just relax your arm. Okay. So I check the bicep and tricep tendons. A two plus is normal, and then we go to the patella tendon underneath. So I'm gonna go down underneath side. So go here. So we're gonna be locate here. Okay, and then we locate for other side. Okay, so that's a leg 2 plus for bilateral knee, and then we go to Achilles tendon. So we locate like the heel tendon on the back. So we can turn the patient here, so you can see. So we can tap here. This part here. Okay, and we do again on the other knee. Okay, so it's tapping 2 plus for bilateral knees, for the knee, and then for the Achilles tendon 2 plus Achilles tendon. And lastly, we're gonna do for the Babinski, for the infant is normal. For adults is some kind like neural deficit. So for the foot, we can by sliding for the foot, we can see here for the foot, we can draw the foot from here using this side to draw up on this side. So see negative for Babinki. And then this one we can do draw here. See a little bit tickle, yeah. So no, it's normal for her. So abnormal can be fainting out of the toe, the big toe fainting out, dorsiflexion of the big toe. So that is normal finding for her. So that should be absent. So that's it for today our um, assessment for neuro and some part of the muscular. And then thank you for joining me today, Teresa.
Yeah, thank you.
Thank you for watching. Have a good day.